Hello everyone. The healthcare landscape is rapidly shifting from a prescriptive to predictive model, and AI is driving this significant transformation. At Aster, we have been in the forefront, seamlessly blending human expertise with AI to usher in a new era of healthcare excellence. Join us in collaborative efforts with providers, researchers, and innovators to unleash the full potential of AI for the greater good of the humanity.
Imagine a future where cutting edge technology meets compassionate care. Together, we are creating that reality. At the intersection of innovation and healthcare, we are forging a new frontier. Yes, I'm talking about the transformative power of artificial intelligence in the healthcare industry. And to make it a reality, we have partnered with the Indian Institute of Science, Bangalore, to pioneer an AI-based application which will help doctors understand their concerns and provide a personalized solution to the patient seeking medical help. This collaborative effort aims to revolutionize healthcare services, making them more accessible and personalized. Together, we are shaping a future of personalized, efficient, and patient-centric healthcare.
Hello, I'm Dr. Anuradha, Consultant Neurologist, Aster CMI Hospital, Department of Neurology. Today we'll discuss about neuromuscular ultrasound. So what is this neuromuscular ultrasound? It helps other electrodiagnostic studies to refine our diagnosis when it comes to neuropathies. For example, electrodiagnostic studies help us in understanding only the physiology, how the nerve is working. Whereas with neuromuscular ultrasound, we can see the structural integrity of the nerves and also their dynamic portion of it. It is a point of care now when it comes to a lot of mononeuropathies, entrapment neuropathies, peripheral neuropathies, neuromuscular disorders, and also a lot of muscle diseases. Since this machine is portable, it also helps us in operation theatre whenever we are planning any nerve blocks and also procedures, so that where we can mark the nerve so that iatrogenic injuries during the procedures can be avoided.
Hi, myself Dr. Lokesh. I'm the neurologist at Aster CMI Hospital. So neurosonology, in that specifically neuromuscular ultrasound. So I've been doing it for almost a decade, and as mentioned by my previous colleague about its various applications, so a thought came up whether using the technologies of AI and machine learning and deep learning, whether we can automate a certain process. Nerve ultrasound needs a learning curve for any neurologist or any doctor who would like to get trained in this particular technology. So we had two problem statements. One, is it possible with using the technologies of AI and ML to automate the detection of the nerve in a given nerve ultrasound? And number two, the way that we diagnose whether there is an abnormality in the nerve or not, we measure the cross-sectional area of the nerve. For that, we have to pause the image and then use a eclipse or a manual measuring tool, and we get the output of the cross-sectional area.
Hello, my name is Fanindra Alavarthi. I'm a professor of medical imaging at the Indian Institute of Science, Bangalore. We primarily work in the area of AI for medical imaging. We have been collaborating with Aster CMI Hospital for the past 1 year by establishing a Aster AI lab, where the aim is to develop some of these AI methods and translate into the clinic. So to this effect, we have been working on automated segmentation of the median nerve using the nerve ultrasound, which is useful for diagnosis of the carpal tunnel syndrome. And this development, we have been doing it for the past 1 year, where we have collected almost more than 150 patients' data and then developed the AI model. The AI model we developed with Aster CMI Hospital uses something known as vision transformer, which is the technology behind something like ChatGPT.
So this is the ultrasound machine I was referring to, and we use a high resolution probe, the holistic probe, and we track the nerve. For any machine learning task, we need the data, and also we need to annotate. Annotation is an important part here. So for any model development, we need to give to the model both the input and the label. So we used image software to create the mask for the region of interest.
Technically, it is set of many programs and many libraries. Importing is important, and in this there is a program dataset loader. This is loads the data, and after that it has another program training the model. In this, we take the data from the dataset and we'll train the model. For this, we have utilized many models like UNet, U-square-net, half UNet, and vision transformer also. After the training, we have tested the model with the existing testing data and at the same time clinical validated data also.
So we developed the model, and now we have to deploy the model in real time. So here we have my ultrasound machine. Now this ultrasound machine has been connected to an image grabber. This is an image grabber where it captures the image in real time, and then we have a model which is loaded here. As mentioned, the two problems which we wanted to solve. The first problem is auto segmenting or auto direction of the nerve. As you can see the arrow mark here on the screen where the ultrasound is there, and here we have the green contour which is depicting the nerve, the model which is depicting the nerve. And the second thing is the cross-sectional area. As I showed earlier, if you have to measure a cross-sectional area, we need to pause and then we need to manually measure the cross-sectional area. But here we can see on the right hand side, the cross-sectional area of the nerve is being measured automatically by the model.
This development with Aster CMI Hospital has opened up new doors for us. We believe that it is only the start of our collaboration, and we are going to develop more such things which will be useful in real time in the clinic. We have plans to segment out other nerves, including volar nerve, and then we also have plans to integrate this in real time with the ultrasound machine. Currently, we are doing some of the trials for that, and then we will go further on this development and then ensure that such a development is already helping the clinicians and make sure the diagnosis is faster and as well as accurate.
So in summary, we can say that the applications of AI and ML can just be an assistant to the existing flow of events in which a doctor interacts with his patients for diagnosis and treatment.